Thoughtful Connections, a memory care podcast, aims to provide general information and insights about dementia and related topics. The content shared is not intended to be medical advice or a substitute for professional medical or clinical guidance.
The purpose or goal of this podcast series is to help inform and educate family members considering memory care for a loved one. Coming to you live from the Haidee and Allen Wild Center for the Arts on the Cottey College campus in Nevada, Missouri.
Welcome to Thoughtful Connections, a memory care podcast, special Q&A session with Julia Baechle from EmpowerMe Wellness. All right, we have a live audience with us today, and we're going to take some questions if anyone has a question. Yes. Elizabeth will give us our first question from the audience.
Yes. So the question was, has the GUIDE program helped caregivers on burnout and reduce turnover?
Yeah, that is a great question. As far as family members, unpaid caregivers still living at home, that is one of our outcome measures that we're looking at. So we have a standardized assessment that is administered to address caregiver burnout and stress at time of enrollment, and then also annually. So because we are right at that 1 year of program delivery, we're still gathering some of that information, but the preliminary data shows that there is some reduced stress on those family unpaid caregivers. Now, caregivers in senior living communities, we actually did a case study in one community, and we did see after implementing the EmpowerMe 360 program, that one community decreased turnover by 23%.
But I was asking them, I'm like, so the GUIDE program is a...
Our second question from the audience is about GUIDE and how individuals or companies partnered with this program.
It's a CMS pilot program.
What's CMS?
Centers for Medicare and Medicaid. So yes, it is a federally funded program. So when they announced this program, organizations had the opportunity to enroll. There were two different tracks. I might be getting too much in the weeds, but there was established tracks and then there was new tracks. So those established tracks were able to start a little bit earlier. And as I talked about, we had a jump start. We already had these integrated service lines. Because one of, you have to have a medical group. So the billing goes through a medical group. There has to be physician or nurse practitioner oversight. And because we already had a medical group and a therapy group and all of these things, we were able to start in the established track. So then the new participant cohort started this July, in July of 2025. So yes, it is open to Medicare enrolled providers, medical groups. You have to apply and there's a lot of paperwork and everything that goes around with it. And then there are, as I mentioned, there's very specific care delivery requirements. There's a participation agreement that's 96 pages long.
Wow.
And so you have to kind of design your own program to meet those care delivery requirements. Like I mentioned, every program is going to look different. We see a lot of the GUIDE program being delivered through hospital systems and things like that. So I think EmpowerMe, our program, is pretty unique because we're one of the only providers that have our specific model with an integrated system embedded in those senior living communities with that interdisciplinary team.
We had another amazing question from a student here at Cottey College in Nevada, Missouri, about this program's impact on more rural areas, such as the town that we are recording this podcast.
Are you speaking more to access to care, like specifically the rural communities? Absolutely. And that's a challenge with all of our business. We are nationwide. We are able to treat patients in 50 states now. And we do serve a lot of our rural communities. Some of those communities are hard to staff ourselves, but we've been really fortunate up until recently with things in limbo with the government shutdown to be able to provide virtual services in those areas where we cannot staff. So as long as there is someone in that community who is able to hold an iPad, ideally it would be one of our staff members, but if we have a hard time staffing that community, it could be a community staff, it could be a family member. As long as they can hold that iPad and help us facilitate that virtual visit, we can serve those residents.
Mm-hmm.
Yes, go ahead.
Your program obviously sounds amazing, but is there any, do you see any ways that it can improve? Like, where do you see this program within the next 5 years or 10 to, be better?
Okay, the question was, so where do you see this program in the next 5 or 10 years?
Man, that's a great question. I have no idea because there have been so many improvements and changes just within the first year that I can't even fathom what it's going to look like in the next 5 to 10 years. That's the great part about the data accountability is being able to have that real-time feedback and understand what's working and what doesn't work and being able to adjust our program. Just within the first year, CMS has already made several updates forcing us to change our care delivery. I think only the data is going to show us what works, what doesn't work, so that we can continue to adjust our approaches and provide the best possible care to those residents and their families.
Now, did you say off the bat, this is currently funded for 5 years? Is that correct?
8 years.
8 years. Okay. All right.
Yes. And we're really hoping, just the amazing outcomes within the first year, we're hoping that it sticks around and that we start to see more managed care payers adopt this program. We're really seeing in general a shift from less fee-for-service toward this value-based care, and this is one step forward.
Anything else? All right. Yes, sir.
So I had a question too, because I know you had said at the start about hospice benefit not being part of the GUIDE program.
Yes.
So I did have a question as far as with dementia patients and the GUIDE program and Empower. If you have patients that are going towards end-of-life care, is there room within that with palliative and hospice then at that moment, or how does some of that navigation?
So when a resident enrolls in the hospice benefit, truly that hospice benefit is intended to be when that person is within 6 months of the end of their life. And so the goals for hospice are really more comfort care rather than rehabilitation. And so that's why the GUIDE program, a resident enrolled in the hospice benefit is not eligible for the GUIDE program because those goals, the goal of the GUIDE program is to keep them in their current level of function longer. And then same for other EmpowerMe services like our therapy services. So we are a Medicare Part B provider. And with that Medicare Part B being outpatient rehabilitative focused, it's just contradictory to the goals of hospice. Not to say that we cannot, there are absolutely ways that we can still serve those residents on hospice. Under their hospice benefit, they do have some therapy benefits, but again, those goals are going to be more focused on positioning and comfort and swallowing. And so a lot of times we will contract with those hospice companies just to provide, it might be an evaluation and 2 visits to change their diet or assess for transfer, maybe a lift or a sliding board, or positioning devices, things like that.
I think that comes down to Medicare is going to pay one service area. If you're on hospice, if you need to be admitted to the hospital, you have to get off hospice in order for Medicare to pay the hospital. So it's kind of they're going to pay one.
Anything else? All right. Well, thank you all. You've been very attentive.
Thank you.
Well, thank you for tuning in for this special Q&A session with our good friend Julia Baechle from EmpowerMe Wellness. We hope you found it most informative and enjoyable.
At Arrow Senior Living, we believe in the power of a chuckle, maintaining a childlike sense of wonder, and defending the dignity of others. Until next time, this is Charlie Johnson with Arrow's Thoughtful Connections, a memory care podcast, wishing you fond memories filled with moments of joy. And remember, if you've met one person with dementia, you've met one person with dementia.
You can find Thoughtful Connections, a memory care podcast, anywhere you listen to podcasts.